Hello guys, let's to talk about febrile seizure. So febrile seizure is a seizure because of the fever. So simple. So the source of the fever should be find actually in order to know what's going on. So no evidence of central nervous system infection or inflammation before or after the seizure. Okay, and no history of non-febrile seizure. So first of all, we are checking for the history of the patient. If in the uh, family had a history of seizure, anyone or like the patient by himself or herself, and then we are going to focus on the source and medications, like which kind of medication the patient intakes, the developmental history of the kid, like which abnormalities during the delivery the patient had, or head circumferences, and any kind of abnormality like neurological. So in the physical examination, we will check for signs and symptoms of the meningitis also. And if we found any kind of like symptoms of the meningitis, then we are going for lumbar puncture at that time. So until we didn't find any sign and symptoms of the meningitis, we don't do any kind of lumbar puncture or anything else. So we have to know about that. Febrile seizure doesn't cause any damage to the brain, and if only a typical febrile seizure or abnormal neurological finding, we do EEG, CT, and MRI. So here's description and difference between atypical and typical like seizure. And when we are coming to the management, we will find out that first of all we have to decrease the fever. That's why we are prescribing antipyretics and some fluids for the comfort. As I said, febrile fever is not causing any damage to the brain, and no prophylaxis with anti-epileptic drugs. If the risk for recurrent or prolonged seizure we found, then we will give rectally or sublingually lorazepam to the patient at home. So here we have some stuffs which are so important. We have to know about them. They can cause actually the febrile fever because electrolytes in the brain or in the whole organism will change, and they can be the cause of convulsion or seizure in the neonate or in the child.